we're on to our last speaker before lunch and then for the workshops. Just before I introduce Maureen to you, can I just say what a fantastic audience you are? It's been a long morning since we've been at this since 9 o'clock, and there's been not an iota of lack of engagement. That is unusual, and I would thank you all very much for just keeping with us. Sorry, your hands up. Yeah? Yes, they're maybe on a website or something like that. But yeah, they'll be up on a website, and because you're right, I mean that presentation is gold, isn't it? As was Ruth's, and I'm sure we'll have another one here as well. Yeah, well, make sure you've got it, and that's a great. Thank you for raising that. To our last speaker of the morning, anyway, Maureen Major, who is a Queen's nurse. I'm a fellow of the Queen's Nursing Institute myself, privileged to say. So, and she's a learning disability health facilitator, which I believe is in the acute sector in primary care. So I'll leave Maureen to explain her job with her props and look forward to more fun by the looks of it. Thank you very much.
And I am a learning disability health facilitator working in Nottinghamshire, covering 21 GP practices. And it didn't actually say on the programme what I was going to talk about. I could talk about anything. But I wanted to talk about an initiative that we have in our area where people with learning disabilities actually have a voice within the emergency CGs and how they are getting better health outcomes for the people with learning disabilities in that area. Unfortunately, the health inspectors couldn't be with me today, but 90% of today's presentation has been put together by them. So the signs and symbols are all the ones that I've chosen. There's a few exceptions, I've put a few in myself. Which button do I press? Okay. I firstly wanted to acknowledge Nurse First because I believe the seed for today's programme came from Sean's attendance at Nurse First. I'm also a graduate of the Nurse First programme, and I think everybody in the room needs to go and see Dave Roberts, Dave Dawes and Holly at lunch break to find out what it can do for you and for your organisation. My project was on blood testing in people with learning disabilities, because quite often people were referred to me to have blood tests and desensitisation work, and actually it was always quite difficult maybe to get the blood that we were needed, that people were scared of needles, and being bled by venipuncture was actually not always the best way to take blood from people. So I looked at alternative ways, and I can safely say that in our area now we are taking bloods via finger prick tests for a number of investigations that are working really well. So that's what Nurse First did for me. But our initiative started in 2011, in May 2011, as the result of the Big Health Day. I'm sure all the people who work in learning disability services are aware of Big Health Days. So we had a locality event, and it was well attended. Okay? But the feedback from the event was people with learning disabilities were actually quite confused about what people in the PCT were saying to them. You know, they came down, they had big words. In fact, they said they might as well be speaking in a foreign language because they didn't really understand what the day was about. However, lunch was great. Yeah, lunch was wonderful. But a few people at that meeting said, actually, you know, if the health service want to know about what we think, can we have a bigger voice? And we said, yes. So we had a meeting. And at that inaugural meeting, Amanda came up with a name, and she wanted to be called the Health Inspectors. So this is our logo. We're called the Health Inspectors. Not that we inspect health, but we want to get better health outcomes for people. So at that first meeting, we decided what we wanted to do, or the group decided what they wanted to do. And one of the things they wanted to do was to help other people with learning disabilities to understand their health needs, understand when they needed to go to the doctor, when they needed to go to the chemist. They wanted to help our doctors and nurses to understand the needs of people with learning disabilities better, because they'd heard reports that people had been dying in hospitals, and they wanted nurses and doctors to be better educated and better equipped. They also wanted to move away from a PCT-led, as it was in those days, big health event, to inventing their own health day, where they could invite the people that they felt they were important to talk to. So that was our inaugural meeting. They also wanted to have a voice. They wanted to be heard, and they wanted to tell their stories. This is Stephen and Gary, who are huge members of the team. But we also know that we needed partnerships. We couldn't do it on our own. We couldn't just barge into the CCG and say, you know, you've got to listen to us. So we know we needed partnerships. So we developed really strong links with the head of primary care operations, Rachel Rees, who also is the head of equity and diversity for the CCG in which I work. Rachel has been an amazing partner for us. She's got us money, she's given us a voice, and she's led us straight into the CCG. We also had partnerships with the CVS, and Lawrence again has developed a different way of working with us and looked at things outside of health and how we might use his initiatives to help us as well. And we're also involved with the community learning disability teams as well, and Ruth and Kathy Ann have been hugely influential in the group as well. But we knew that we needed to know what the challenges were for primary healthcare. What challenges did our doctors and nurses face when dealing with people with learning disabilities? You know, we know that people with learning disabilities have poorer health, but why weren't they getting the health? Why weren't people understanding? Why weren't the doctors and nurses understanding why they should be supporting people better? We also needed money, and again, that's where Rachel helped us. So what we did, we decided we'd find out what the challenges were for primary healthcare professionals, and we went out either with our video camera or with a pen and paper and interviewed a huge number of healthcare professionals across primary care. These included doctors, nurses, physiotherapists, people in MSK, chiropodists, podiatrists, venipuncturists, OTs, a whole remit of people, reception staff as well, to find out where their problems were with supporting people with learning disabilities. And I'm sure most people understand the biggest barrier that people said was communication, that people didn't know how to communicate with people with learning disabilities. But 78% or so of people in primary care had never provided healthcare to somebody with a learning disability. So they were scared. Not scared of people with learning disability, but scared of getting it wrong. So we knew what the challenges were for people in primary care. We also knew that they didn't actually understand the Mental Capacity Act. So we wanted to do some work on that. So the group decided they wanted to do a play. I don't know if you know much about primary care. About once every month, GP services have a protected learning event. And it's an event usually on a Thursday afternoon when surgeries are closed. And we get as many GPs there as possible, where it's their learning, where they do their CPD. And if you think about general practice, they have to be generalists, so they have to know about everything. And learning disabilities isn't always high on their agenda because they have low patient population compared to people with asthma, compared to people with mental health problems. However, with Rachel's influence, we managed to get a protected learning event that was well attended. There were about 80 people there, all healthcare professionals from primary care, GPs and nurses. This event was chaired by people with a learning disability. Raymond and Eddie chaired the whole event. They knew that I'm not very good with technology, so Eddie did all of the technology for me, and Raymond did all the chairing of the event. Raymond also told his story at that event, and he had a really, really, really powerful story. And I think you can probably see the difference in Raymond's weight there. Raymond was presenting with vomiting. He kept going to his GP, and his GP put it down to depression and sent him to bed with antidepressants. His care home thought it was a behavioural problem because he started to eat paper. Eventually, Raymond was seen, and it was decided he needed to go to endoscopy. Raymond had a stricture in his throat that needed treatment. It needed to be stretched. So he could have gone on being treated for depression and for anxiety when actually he had a physical health problem. And this is the power of the patient's story. Patients are the most underutilised resource in the health service. And this is a quote from one of the... I'm nearly falling off now. One of my nurse first colleagues, Jane Cook. But one of the doctors at the event, Dr. Gallagher, said, as a GP with 30 years of experience, Raymond's story has been one of the most powerful learning experiences in my career. So we knew that by telling people stories, then GPs and nurses were going to get things better for people. In 2012, we held our own big health event. We called it a mini health day. And the group invited a panel of experts that they questioned. Rather than the panel of experts questioning the people with learning disabilities, they put some very pertinent questions to them. We had representatives from social care as well, and one of the big questions is, why are my day services being shut? Why are my benefits being changed? And the impact that that was having on people's health. It was a really powerful event as well. The other picture there is Amanda interviewing one of the occupational therapists from the local primary care team. Again, that went down really well. People were telling their stories. As a result, or as I believe, as a direct result of all these initiatives, our annual health checks in Nottingham North and East CCG went up from 56% in 2011 to a whopping 68% in 2012, an increase of 12%, which was probably one of the biggest increases in the country. We continue. We haven't just stopped. We know that it's not just about getting the health check. We want to have a quality health check as well. So the health inspectors continue to teach people. They continue to teach not just healthcare professionals, but they also realise that social care professionals also need more advice and education about meeting the healthcare needs of people with learning disabilities. We continue to plan. There are photographs here of Stephen. Stephen is a member of his patient participation group in his local GP service. Stephen isn't the only one of our health inspectors that is on a patient participation group. In Stephen's practice, because of his attendance at the practice, the way appointments are made for the whole population has changed. It was one of those systems where you phoned up, four different options. 1 for appointments, 2 for blood tests, 3 for this, 4 for something else. Stephen's had it turned around where now is you get the message, if you want to make an appointment with your GP or nurse, stay on the line. For all other calls, press 1. So there's only one option there, which reduces the anxiety for somebody with a learning disability, and if it was my practice, for me as well. I can't see very well. Again, for Stephen, it was really important that he continued to talk to NHS doctors. Stephen loves attending the meetings and that it's had a reduction on his anxiety levels. And Stephen also wanted to be part of a Lakeenders group, which is a drama group as well. But we needed more funding, and we didn't even apply for the funding. Rachel went out and got an innovation fund of £10,000 to support us to develop some bespoke training for our primary care professionals. And our bespoke training consisted of a 10-week programme of drama we again developed partnerships with Nottingham University and Lakeside and the Meander Theatre Group. The Meander Theatre Group is a well-established drama group for people with learning disabilities and learning difficulties. We joined up with them and they became peers to our health inspectors. So they were all married up with somebody who'd walked the walk. During that 10-week programme, the drama teachers listened to the stories of people with learning disabilities and we decided to make these into short films. So we have 3 short films that are part of our training package, and these are real-life stories about people's experience of not just the health service, but of social care as well, and about being listened to. So these are really powerful stories. So we show these to all our GPs as part of our practice. We developed a bespoke board game. This is the short version, this is the tabletop version of it, and again this is thanks to Nurse First and Anna who would make a game out of nothing. I mean, luckily I had some money to make the game. We have a human-sized board game that we put on the floor for GPs and people within primary care practice. Because it's not just important that they listen to people with learning disabilities, they also need to upskill and learn that people with learning disabilities may present very differently. They may be atypical presentations, so GPs and nurses need to know what to look for. So there's a game programme, and the GPs have taken to this really, really well. We add a competitive edge to it as well by giving tokens for good answers. It's not about winning or about losing, but it's about a different method of giving a message to people. And GPs have really welcomed having something different to listen to and something else to do. The other thing that we did, we were approached by Gedling Borough Council, who'd got a little pot of money and said, we've been told we need to do something with people with learning disabilities, with art, and how that could improve their health. So I took this to the health inspectors and said, what would you think people would like to do? And they said singing. And I said, that's not on my list. Why do you want to do singing? And they said, well, people who sing are happy people, and happiness is really important. So I went back to Gedling Arts and said, they want to do singing. So they provide us with a singing coach, and they gave us money for a 6-week session. This was leading up to a big event we had to promote and launch our training programme. And we decided, as part of this singing group, because we knew that some of the health benefits were that people were going to be taught how to breathe properly, so we'd have a reduction in chest infections, that it was part of a team, that anybody could take part, even people with profound and multiple disabilities could be part of this singing group. But the other thing that happened is that we decided we'd make a rap song. And again, Mel and myself interviewed the people that were at the group and asking them their stories about what it's like when you go to the health service, what's it like for you? And the overwhelming thing that people said to us is, people don't listen to us. So we made a rap song, and it's called Listen to Me. Not my carer, not my family, but listen to me. We've had news this week that the song that was performed at the launch has gone down so well with the counsellors that they've given us the money to have it recorded professionally. So hopefully that will be on YouTube soon. Our efforts have been recognised, and it is a team effort. There's no I in our team. We won Team of the Year at our NHS Healthcare Trust Oscars. It was the first time that people with learning disabilities had won an award for something they'd done. We were the first ever group not to win one award, but we won 2 awards. We also won the Liam O'Neill Fighting Stigma Award. The steering group are there at the event, and they thoroughly enjoyed it. This year, our annual health checks have gone up from 68% to 79%, which is a massive, I think it's probably one of the highest rates in the whole of the country. And we believe that is because we are engaging better with our primary healthcare professionals. We're understanding what their needs are, not just the needs of people with learning disabilities, but understanding the difficulties that our doctors and nurses face in supporting somebody that they don't understand, that they may never have met before. And we're really excited about that. And that's the end of my presentation, just in time for lunch.
Okay, thank you, Maureen. That was absolutely fascinating, and shows exactly how you can utilise a range of different methods to engage with people, to create partnerships between practitioners and people with learning disabilities, and create real hard results as well that have a message for the people who spend the money. So I think that was absolutely fascinating.